Welcome, mamas, to our postpartum pelvic floor webinar. We've got with us today Michelle Campbell. She's a registered physiotherapist and she treats prenatal and postpartum moms all the time. She is very busy, so we're super happy to have you, Michelle. So take it away.
Yes, well, thanks so much for having me, Hannah. Yes, just like Hannah said, I'm a pelvic floor physio, located in West Kelowna, BC. And yeah, I work in clinic at a local clinic here 5 days a week. And then I've got an online kind of business doing virtual pelvic floor physiotherapy as well. In clinic, I have kind of like a mix of general orthopedic stuff, so any injury kind of head to toe. And then I've got within that probably like, yeah, about 30% of my caseload is pelvic floor. So yeah, I deal with all sorts of different types of conditions. Love the pregnant and postpartum population. It's super fun. And we tackle kind of any pelvic pain. So kind of any pain from basically like pelvis, low back, and into our pelvic floor, any pain in any of those areas. Any conditions that might include, as well as any sort of incontinence, fecal or urinary incontinence, and pelvic organ prolapse, and just general any postpartum concerns, basically. So, yeah, that's kind of me in a nutshell. But I really love the pelvic health world. It's been one of my favorite things to do for the last few years. So, pretty excited to be here too. So, thanks again, Hannah.
Great. So, Michelle, can you tell us, and for the people watching this as a recording and people live, what exactly happens to our pelvic floor when we get pregnant and when we have our baby, whether we had a C-section or vaginal delivery? Maybe just explain what happens to our pelvic floor exactly, and then why do some of us have stuff going on after?
Yeah, no, and such a great question. Yeah, and so during pregnancy, as all of you lovely moms would know, there's so much happening, obviously, from kind of like anatomical perspective, but physiological too. So all of our systems, basically everything naturally is different as you're making room and growing a literal baby inside of you. So with our pelvic floor specifically, I've got a fun little model, which I always find super helpful for both myself and patients. But these are kind of our pelvic floor muscles. So if we're looking at our pelvis, these are our kind of, we always say hip bones, but our pelvic bones, so kind of at the side of, yeah, kind of lower down. And then we go right into, front part here is our pubic bone that we can kind of feel on ourselves. And then our backside, we've got our sacrum. These are our SI joints, which I feel like we also kind of hear a lot about those guys. So our lumbar spine, and then down into our tailbone or coccyx. So our pelvic floor muscles are kind of a bowl, essentially. So most of them go kind of front to back to front. And then we've got a few that kind of go side to side. So these are our lovely sits bones that I think, Hannah, in yoga we talk a lot about. But yeah, so those are those guys. So side to side and then front to back. So they just act as a bolt here, essentially. So generally, like in a normal, prior to pregnancy, they're holding up our entire abdominal cavity, responsible for our bladder and bowel health. Sexual function, of course, and kind of act as a way to help bring fluids back to our heart and kind of like a bit of a circulatory function as well. So yeah, just nice to have a visual. So I just want to show you guys that. But during pregnancy, of course, as you guys would know, everything's opening up. Obviously, our pelvis making way, especially later stages of pregnancy when sounds like things are nice and sore, get sore anyways. So these guys are, taking on even more load because now you've got baby over here, right? So what can happen is we can, start to have a bit of dysfunction in these guys throughout pregnancy. So, we're just generally, going pee more often during pregnancy as a result of our kidneys, working harder and more, as well as, later stages, babies kind of starting to push on bladder, which would be kind of right here. So anyway, these guys just are taking on a lot more, just basically from weight of baby during pregnancy. So postpartum, what we see, depending on how you gave birth, vaginal or via C-section, if you gave birth vaginally and have any sort of kind of perineal tearing, then that'll affect the muscles because the tearing goes directly down into the muscles. Or if you gave birth via C-section, which our core muscles would be right here. And then, of course, it's a major abdominal surgery. So either way, we can have dysfunction. It actually doesn't matter which way you gave birth, we could still have the same amount of dysfunction. Or some women get off scot-free and are totally fine, which is amazing. So wherever you are kind of in that spectrum, again, any sort of like muscular tearing or any sort of anything going on, your body's recovering, right? And of course, just not having baby inside of you anymore, all our organs, which would sit right on top, everything's readjusting postpartum as well. So we can then see, certainly some pain at the tear site if there was any tearing, pain along C-section scar, but just generally after any type of, trauma is a bad word, but the tissues themselves went through, a lot during childbirth, again, whichever way you gave birth. And so we need that retraining essentially. So we need to relearn how to use the muscles, and pelvic floor muscles in general. Most of us didn't really know even prior to pregnancy and then during pregnancy how to use them. So we just have to kind of relearn basically how to use those muscles again postpartum. So things do come back postpartum. Muscles do really well, and they might just need a little bit of a help from a pelvic floor physiotherapist in order to know exactly what to do with them. But everything comes back and things function properly again. So always important to note in our postpartum population.
We have a question that just popped up that relates to this.
Yeah.
Does an episiotomy affect pelvic floor muscles more than a tear?
Right. So yeah. So again, from if we look at just where an episiotomy would be from the posterior backside of our vaginal wall down to our anus or rectum, yes, like there's this large cut here, right? Versus some tears might not be as severe. They could go almost the whole way, and sometimes all the way. But certainly like that cut versus tearing during childbirth can be a little bit different. But again, bodies are super incredible and amazing. So they heal, right? Like we get healing as we normally would throughout anywhere else in our body. So we might have, an increase in scar tissue after an episiotomy, but that's when we focus on some scar tissue massage, and kind of trying to get that tissue in the best shape it can be postpartum if there was an episiotomy. So yes, I don't know if I
How
answered
would you
the question.
massage that area? How do you,
Right.
is it with your thumb, Michelle? Like, how do you massage an
Yes.
episiotomy scar? Because I feel like that would be really, like, I talk to so many women postpartum and they say they have a dissociation with everything
Yes.
lower than their belly button. It's like they don't want to think
Totally.
about that area. They don't want to look at it. They don't want to
Yes.
connect with it
Yeah.
at all. I see some people
Yeah.
nodding too. It feels like it's like, I don't want to go there. I don't even want to look at the damage done, even your
Yeah.
C-section too. I feel
Totally.
dissociated with that part of my body. So like, how do
Yeah.
you massage an episiotomy scar? Like I couldn't imagine that kind of
Yeah.
trauma. I tore both times
Right.
with I think first time was second degree and the other one was second degree both, but I just would never massage there. Like,
Right.
and I
Yes.
feel
Right.
like I
Right.
missed out on healing because I was just like, I don't want to touch there. I don't want to go there. I'm just going to go about my
Yeah.
day. But that's
Mhm.
why I love doing these chats so much with you, because you're in favor, as all pelvic floor physios, is
Mhm.
like touch that area, massage it, and help the
Yeah.
healing, right? So how would
Totally.
they do
Yeah.
that? And when would they start?
Yeah. Yeah, no, and such a great point. And that's a lot of what we do postpartum with women is just that education piece too. Because yeah, like you just said, and I haven't had children myself yet, but yeah, I can only imagine that, dissociation exactly like you talked about. But it's kind of like anything, if we, it's kind of like the age old, I feel like physio saying, if we don't use it, we lose it, right? So what happens is it kind of becomes a bit of a brain game. So the more we stop paying attention to say anything abdominal region and down, the less our brain kind of sends stuff to the area, the less it really cares about the area. Essentially, like our brain's so plastic and it remodels, so it just doesn't give as much attention to the area if we stop thinking about it. So you're right, that's totally part of it, is whether C-section or vaginal birth, we really want to start thinking about the area again. We want to look, because our visual system is very important. So if it's a C-section scar, we want to look at our C-section scar, especially if there, again, with C-section, if there's any sensitivity along the scar line, we want to start by kind of gently, touching it, and again, reminding our brain that we're okay, and things are good. And you just went through this incredible major surgery, and then now you're like, making sure a newborn is still alive, like insane. Women are amazing. But so we really want to start to kind of, again, remind our brain that, we're good, things are healing, and we just did this incredible thing, basically. And yes, absolutely, if we're thinking from any type of tearing or episiotomy scar, we want to wait until scar, the initial first couple of weeks till things are relatively healed, essentially. So after, like, and if you've got your midwife or OB or family doctor, whoever your healthcare team is, once they give you the okay that things are like really well healed, then that's when we can really start that scar tissue massage. So exactly like you said, Hannah, like it's an awkward area to get to on ourselves, and it's low and just generally a hard area to kind of get to. So yes, I always teach using our thumb, and you don't need to go in super deep. So because of where, again, the perineum is, if we go in just about our first knuckle on our thumb, and insert, and we do, some sort of scar tissue massage, the nice thing with any type of scar tissue massage is that we don't have to be super exact on how we do it. So if, again, this is kind of our scar, whether that be kind of down the perineum or at C-section, wherever scar may be, we can go kind of back and forth on this guy. We can go do circles, we can go up and down, but we're just applying a little bit of pressure to kind of help the scar tissue heal. And it's a process called remodeling with the scar tissue. So we're actually helping the body take up the kind of bad scar tissue, or the not so nice scar tissue, and then lay down better, more mobile scar tissue for long-term kind of success. Again, whether at C-section or vaginally. But exactly like Hannah said, to immediately postpartum, we kind of want to look at the area, feel the area with our hands, if we can, whichever way you gave birth, and just reconnect with it as well, and knowing that your body is in this amazing healing process and just did this incredible act. And so reconnecting as soon as possible. Postpartum is important, and then scar tissue massage once we kind of have the okay from your healthcare team that the scar is nicely healed.
Perfect. So let's go into strengthening. So
Yeah.
so I had an emailed question before we started today. She couldn't make it, but she wanted to know, how do you strengthen the pelvic floor other than Kegels or a child's pose?
Yes, definitely a great question. Yes, we always hear just do Kegels and you'll be fine, kind of thing. But while they are important in actually activating the specific pelvic floor muscles, that's not all we want to do, of course. When you see a pelvic floor physio in person, we often, again, if the person's okay with it, we do an internal exam, and that allows us as the physios to feel the muscles. And so we do an internal exam, usually vaginally, and then sometimes rectally if it's indicated. But it allows us to kind of feel if there's like tense, tight knots in our pelvic floor, if there's weakness, if there's like not looseness, but just muscles that aren't being activated properly. So anything that could be kind of off, it allows us to feel that. But you can kind of check in with your own pelvic floor too. Like you can really think about what the muscles are doing down there. So what we find, and again, instead of just Kegling, we actually just need to learn how to control our muscles a lot of the times. So really, again, checking in with them and seeing, can we feel like, do we feel tense? We can think kind of at our rectum, kind of more at our backside, like, oh, does it feel like we're squeezing? Or then think more front side at our vagina and urethra, like, oh, same thing. Does it feel like I'm squeezing? Does it feel like really long and elongated and relaxed? So yeah, yeah, this is my very long-winded answer to say, depending on what you're kind of presenting with. So say you're coming in either virtually or in person and saying you're dealing with a lot of incontinence and pelvic organ prolapse. Generally, we're kind of thinking, okay, so maybe there could be some weakness, and we might move to more of the Kegel-based strengthening stuff as one exercise, not the whole thing. Versus if you came in and you're having painful intercourse or general pelvic pain, any pain on any type of insertion, then we might be thinking, okay, the muscles might be a little bit more tense, and we really want to focus on that lengthening of our muscles. But regardless, when people come in, either again virtually or in person, pretty much always give them an exercise that we pair with our diaphragmatic breathing to again learn that control and reconnect with our pelvic floor muscles. And that's kind of where we're going through the lengthening phase of the muscles, but we're also doing some sort of gentle squeeze or Kegel to kind of really start to feel those muscles again. So learning control is kind of step one, and then we look into whether we need more Kegeling or anything else. And because of where our pelvic floor muscles are, if we had our hip joints, it would be in these guys here. And so we look at, glutes. Glutes would be on the back side. So we would do a lot of, glute strengthening or stretching, whichever we kind of need. We do a lot of abdominal core work to strengthen or stretch the area as well. So it's about all the surrounding musculature too, and not just looking at just the pelvic floor muscles. We want the whole kind of full body approach. Yeah.
That's why I love my mom and baby yoga series, because I start with the pelvic floor and how to teach a Kegel, but then I go into
Yeah.
the next class is we go into the transverse abdominis.
Yes,
And then the next
totally.
class is the obliques, and then we go into the glutes. And I'm like, all of these are connected to your
Yeah.
pelvic floor and sorry, my dog's barking, but a healthy low back. So
Yes,
healthy
totally.
low back, and all this is contributing to pelvic floor, because the mom that wrote me that, she says that she's leaking every time she even like folds over, like she like goes
Right.
to bend over and pick something else, leaks.
Right.
She says she coughs
Yeah.
and sneezes, leaks. She's like, oh my gosh, like I
Yeah.
feel like I have to always wear underwear with a little pad in it because
Yeah.
I'm
Oh,
constantly leaking and peeing myself. And all I feel
yeah.
like
Not
it's,
fun.
is that all I can do is Kegels? So I was like, oh, I'll ask
Right.
her.
Right. Okay. Yes. No, there's so much more.
There's so much more. And like you said, it's like the surrounding muscles as well that
Yeah.
help strengthen and lengthen. It depends what they need.
Totally. Yeah.
Okay, so those are my questions. Let's go into the chat box. We've got a question. How can I help my random bladder pain when I'm emptying my
Mm.
bladder? 10 months postpartum.
Right. Okay. Um, yeah. So kind of like the another fun healthcare phrase, but it really just depends on how you give birth, when the pain is happening, and how it's happening. We would kind of need a little bit more information, unfortunately, for that one, in order to kind of properly answer it.
Mhm.
Um, so yeah, yeah.
Maybe
Sorry,
I'll
that
get
was
her
a
to come
phrase
on
answer.
mute at the end when we finish the recording, that she can
Yeah,
chat a little more with you.
yeah, yeah,
Because that's more private. I can I
yeah,
can
yeah,
to stop the recording, then she can explain in the group
yeah,
what that is, so you can answer more.
yeah. Totally.
Another question: why is pubis symphysis pain worse with subsequent pregnancies?
Yeah, yeah, no, great question. It can be a number of factors. So, just for anyone who doesn't know what that is, so if we're looking at our again pubic bone, which we can feel at the bottom of our abdominal muscles, is this guy here, and kind of in between we've got this ligament, and that's our pubic symphysis joint here. So yeah, that would be kind of pain on the front side there. So basically, yeah, again, kind of depends on how many kids you've had over time, and a lot of it can be how much time in between pregnancies there were too. If you were pretty quick to get pregnant again after your first or second or whatever it is, then your body, depending on how you were able to get back to activity and if you were strong and that kind of stuff in between babies, if again you got pregnant maybe quick and didn't get back to everything that you would normally do, or weren't as strong as you were leading into your first pregnancy, then that can kind of sometimes lead to a bit more pain here if we don't have that again surrounding muscles to support the area. Then that can lead to a bit more of increased pain. If there was any sort of issues during any prior pregnancies here at your pubic symphysis, that can then lead into continued pain there. We used to kind of think too, like, I think I was saying, chatting with you about this too, Hannah, but in our pelvis and during pregnancy, we release a hormone called relaxin, which basically lets ligaments, which are supposed to be kind of dense, thick connective tissue, be, they're supposed to be really strong and hold bone on bone. So we have this guy here at our pubic symphysis, and then we've got, lots of ligaments on the back. Actually, these blue things are supposed to be ligaments here, so you can kind of see them, like big, big ligaments. So again, anything in our pelvis, we're opening up and making room for baby. So we used to think that that actually could be a cause of pain, but we know now that that's actually not the cause of the pain whatsoever. It's just, again, how our body responds and with surrounding muscles to then support the increase in laxity or increase in movement during pregnancy. So often it can be, due to again, kind of some weakness if we weren't quite as strong, depending on where we're at in between pregnancies again. But or again, how you gave birth, if there's any issues pelvic floor wise, because as well, if our pelvic floor, if there's any dysfunction, so again, too tight or too weak, then this isn't supporting at our pubic symphysis either, right? So usually muscle related, essentially.
Usually muscle related. So what can they do to strengthen the muscles around there now? Like what exercises did you give this person?
Yes, no, great question. So kind of like you talked about, I would give a lot of like core stuff because all three of our different core muscles, so our transversus abdominis, which you talked about, Hannah, our rectus abdominis, which is kind of like our six-pack layer of abs, and then our obliques, which help us twist. They all come down, they insert our obliques more on the sides, and then our TA and RA come down right into our pubic bone here. So I would give definitely lots of like gentle core strengthening stuff at first, and then kind of build and progress. And then, again, depending on what's happening with pelvic floor, hips, glutes, everything around the area, we might just need some more strengthening depending on what, again, what's happening with the muscles, if they're too tight or too weak or whatever else. So, yeah.
So what if they're pregnant? What if they're pregnant, they're starting to get that pain and it's harder to do those core exercises? What are some ones you do in pregnancy for the core? Like I can think of the ones I do in yoga, that a lot of it has to do with just like, I say like hug your baby, think of hugging baby towards the spine to engage. And then like even like a holding a bird dog, like that kind of thing. What would you say?
Yeah, no, that's awesome. Those are great. Give those quite often as well. So I'd say transversus abdominis is super important in pregnancy, just to help support our rectus abdominis, which is the one that we can get that ab separation, or diastasis rectus abdominis. So our TA underneath our RA help support that. And absolutely, I would give some form of, kind of glute exercise. So bird dog, glute bridges, anything like that. And kind of that low back, like with what you would get with bird dog as well. That's all really great. Sorry, what was your question? I just realized
just like any more exercises that they could do when they're pregnant.
Right. Yeah. Right. Yes. And kind of, I would definitely give diaphragmatic breathing. So really good belly breathing during pregnancy too, which gets complicated, of course, because you've got a baby in the way of our diaphragm. It's literally getting stuck, but trying to engage that as much as possible can actually help reduce that pain too. There are short-term things, like pregnancy belts that we can wear that some women find helpful if they're still working, say, and having a hard time getting through the workday because of pain. Then that kind of stuff can be a good short-term option. But yes, I would say any sort of like gentle core work, breathing, and then glute work around the area to help reduce that pain, and just staying as active as possible. Like if walking feels good, then walking as much as you kind of can, depending on where you're at in pregnancy. But just basically gentle, nice movements are important.
Yeah, I like so much of my prenatal yoga is glutes. all the time because
Yeah,
I know that the
yeah,
glutes during
totally. Yeah,
pregnancy, they turn off. They cheat.
right.
It's like
Yes,
these
totally.
huge
Yeah,
mover muscles that are like,
yeah,
I'm not going to work as hard. And then it
right.
causes all these problems. And really, like, it's just like targeting that area and getting it to keep firing, right?
Totally. And so functional too, because of course, our glutes, if we think of a squat, we're doing a squat every time we go from like a sit to a stand or a stand to a sit. That's a glute dominant exercise, or should be for the most part, anyways. And it's functional. We do it all day, every day. You're going to have to do it postpartum with baby, like immediately. So the stronger we are, during pregnancy or even prior to pregnancy, the better off we are postpartum. So yeah, totally. That's always a good one. Any glute thing, anything, really.
Great. Okay, we've got a question. What can cause a rectal cell prolapse bulging to come back after it was healed with pelvic floor physio?
Right. Yeah. Yeah. So I'll
You
just
want to
kind of
tell us what
quickly,
that is?
yeah. So I was gonna say I'll quickly tell you what that is. Um, so again, our lovely model, I just find it handy. But so if we were looking kind of, yeah, top down at our pelvic floor, we would see our organs. So we would see our bladder. Here, I'll maybe hold it this way. So we'd have bladder here. In behind bladder, we'd have vagina, and then we would have rectum on the back, and then leading out, of course, vaginal opening, and then anus. So those three are kind of like our big main organs immediately attached to our pelvic floor muscles. So what happens postpartum, and actually, women, it can happen any time in life as well. But if we've got weakness in our pelvic floor muscles, or say, we were pushing so hard during, labor and delivery, we can get a pelvic organ prolapse, it's called. So there's three different types of prolapse. There's one where your uterus prolapses down into your vaginal canal. So you would kind of feel your cervix come down. We have our bladder, which is called a cystocele, which would then prolapse down into our vaginal wall. And then we've got our rectum, which could then prolapse down and into our vaginal wall. So basically, some women, depending, we kind of always grade them on a grade 1 to 4 scale. Some women can complain of feelings of heaviness or pressure down kind of at their vagina somewhere. And some women can see a bulge coming out if it's a little bit, higher of a grade of a prolapse. But basically, they all kind of feel the same, like you've got something coming towards the opening. With a rectocele, especially, again, I should also note too that, even if there is some sort of bulge coming out, it's not the actual organ. The organ is protected by muscle and tissue. So there's not going to be any damage if there is some protrusion coming out externally, but just so you know. So a rectocele that, was kind of like the question, relatively healed or doing well after pelvic floor physio, but then kind of came back. It could be due to if there's any issues with any bowel habits. So if someone's kind of chronically constipated, is always feeling like they have to strain, to start their bowel movement and really pushing, that can actually increase the severity of a prolapse over time if we're doing it kind of too much. Or yes, it can kind of bring it back if we were feeling, pretty good and functional and weren't feeling those symptoms anymore. Then yeah, it's kind of due to prolonged constipation or any bowel issues where we're pushing against tight muscles, that then kind of can prolapse again or feel a bit increased again, essentially.
So it's all these organs kind of stacked in, but all of them
Yeah.
are either all of them are out the vagina. So is the
Yes.
tissue
Yes.
that's
Totally.
actually bulging vaginal tissue?
So yes, yeah, exactly. It's the vaginal wall tissue. Exactly. Totally.
Okay.
Yes, exactly. And so that's why you don't hear of prolapse like this in men, because they don't have the vaginal canal, of course. So women, just given we've got one more, large opening that men don't have, that's when we can get the three different types kind of prolapsing in and out. But I should also kind of caveat that with saying, the evidence and the support in the literature is so strong for pelvic floor physio that, say, again, we have grade 1 to 4. So if you're at any grade within that, the evidence is so strong with pelvic floor physio that we can reverse it by a full grade. So, you might not ever go back to absolutely no prolapse, but you'll be totally functional. You won't have your symptoms anymore. And you'll just get back to your normal kind of day-to-day life, which is really awesome. So there's way less surgeries happening, and they don't really do mesh kind of surgeries anymore that we used to always hear about with the bladder. Anyways, surgical outcomes, we've brought that way down, that women have to go have surgery, which is really nice. So yeah, pelvic floor physio, very effective. They have found out, which is cool.
So what about if the person that the chat says, what if they're not dealing with constipation and they're getting that
Right. Yeah.
happening?
Yes. Also a great question. It can be, again, depends. So many factors. Depends on if there are, if you're still doing your exercises or not. If we've kind of lost that connection with our pelvic floor muscles, we would kind of go into more, chat more about bladder, chat more about all these other kind of factors if there's anything else going on, to try and figure out why. Again, hard to say without a bit more information.
Why don't we do that one when we come back? We'll close off this recording soon, and then this person can unmute and ask and tell you
Totally.
everything, because I know that they're
Perfect.
probably thinking like, I have so much more to tell you.
Yes, right.
So yeah, so because we'll give time for question and answer, but
Yeah.
basically, moms who are watching this recording, go see a physio before you give birth, and do
Yeah.
not suffer through these symptoms postpartum. Oh, we've got someone joining now. Do not suffer through anything postpartum. Like, go see a pelvic floor physio, and if you can't book someone in your community for whatever reason, Michelle does virtual appointments, so you can talk to her. She bills it anywhere. I think I don't know how billing would work, but you can treat people if you're in America. I don't think it works to bill your benefits there. In Canada,
No. Yeah.
you could do, like in British Columbia where she is and I
Yeah.
am, you
BC.
could get it covered. But I mean, this stuff is worth it. This is like something, I mean, our health as women with our pelvic floor is so important. And I always say in mom and baby yoga and prenatal yoga, a healthy you is a healthy